Hi, my name is Bev Crawford. I've been a member of LAUMC for 42 years. Some of you may remember me from Angels on Call that I coordinated for 17 years. It is with a grateful heart that I introduce this week's Advent Generosity beneficiary, the Ukrainian National Children's Hospital. When the Advent Generosity team was considering the Ukrainian relief effort as a possible beneficiary, they contacted me and asked if I could put them in touch with my friend Dr. Joseph Siladi. Joseph is a pediatric doctor at the National Children's Hospital in Kyiv. He was overjoyed that LAUMC would consider supporting the hospital. At our request, he put together the video that you are about to view. I want to tell you that it was not an easy task for Joseph to make the video, with hours of blackouts and no idea when they would have had power, but he did it. Joseph, his colleagues, and the hospital's administration are thankful and grateful for LAUMC's interest in supporting their efforts. I ask that you watch the video with a prayerful and generous heart. This cause is very personal to me because of my connection with Joseph's family for 40 years. You'll find an insert in the bulletin today that tells that story. I hope you enjoy the personal background. Thank you, and here is Dr. Joseph Siladi.
Hello, American friends. My name is Dr. Joseph Siladi. I am honored and pleased to introduce myself to all of you. My team and I are very grateful for your support, standing with us and sending your help here. I am a happy dad of 2 sons. I have a beloved wife. I work as a pediatrician in Diagnostic Infection Disease Department, Ukrainian National Children's Hospital Ohmedit. I work there since 2010. The Ohmedit Hospital is the biggest one in Ukraine among all children's clinics, and it is various ones that serves patients from all over the country. Our hospital includes about 80 diversified departments. It is a whole town consisting of different buildings, new and old ones, in need of renovation or upgrading. My department specializes in infection disease and immune disorders. Only our department treats more than 600 patients annually. One thing about our department is that our little patients, no matter who babies, toddlers or teenagers, have to stay for weeks or even for months in the hospital for diagnosis treatment. Those children stay here together with their parents, but our patient room are 2-bed or 3-bed, and that is a big challenge for families who share room with others. Our work is to diagnose the unclear patient's condition. For example, a child has a high fever or some immunity problem for a long time, and he or she has been already examined at all levels in regions, but they have failed to detect any disease. Then the child is referred to our hospital, where my team should do our best to help such families. The Ohmedit Hospital covers all the pediatric problems and provides medical care to children with oncology, rare disease, injuries, kidney failure, genetic disease, and etc. Some of our patients are on life support devices and they cannot be taken to the bomb shelters. At these times we are doing even more we can. Currently Ohmedit has become not only a place where people are treated but also a shelter and temporary home for mothers with their children who have been stuck here during and after the treatment in war times. Since the first days of war, the hospital has sheltered not only patients but also the staff, even with pets. Our doctors provide all the necessary medical help and accepted all the adults who have suffered because of war. In our department works a team of 6 pediatricians and our supervisor who is a leading doctor as well. There are also 15 nurses and other junior medical staff. We all work as a close-knit and devoted team, having one aim to provide any help we can. I'm sorry not sharing with you our joint photo, since we all have different shifts and rotate often. So it is hard to bring us all together. At last, I want to say thank you again for your attention and solidarity.